It's 5:30 p.m. here in Singapore. You're watching The Big Story, where we discuss the hottest topics of the day and explain why they matter. I'm Haryanto Diman, coming to you live from the Straits Times newsroom. Malaysia confirms its first citizen to be infected with the coronavirus, bringing the total number of confirmed cases in the country to 10. The Malaysian man had travelled to Singapore for a meeting in mid-January with colleagues from China, including one from Wuhan. Meanwhile, also a first, a man in Hong Kong has died from the coronavirus, making him the second fatality outside mainland China. The man was 39 years old and had an underlying illness. He had travelled from Hong Kong to Wuhan on January 21st before returning 2 days later. It was reported that he had not visited any healthcare facilities, wet markets or seafood markets, and had no exposure to wild animals during the incubation period. The first death outside China was reported on Sunday when a 44-year-old Chinese man died in the Philippines after arriving from Wuhan. With the whole of China in virtual lockdown, travel to, from and within the country is severely restricted. Some countries, including Singapore, also barred all travellers arriving from mainland China who had been there in the past 14 days. 427 people worldwide have died from the virus so far. In China alone, the death toll rose by a record 64 yesterday, while the total number of infections in the country has surpassed 20,000. Now to tell us more, we have China correspondent Elizabeth Law. Hi Liz.
Hi Jan.
Liz, I understand that you are still quarantined at home.
It is my last day. I'm coming back to the office tomorrow. Look at this giant smile on my face. Okay, no, sorry. We're talking about something serious. We are certainly looking forward to you coming back here in the office. Now, Liz, the number of deaths and infected cases are climbing day by day. China's top leadership has admitted shortcomings and difficulties in its response to the coronavirus outbreak. Now, moving forward, what is the Chinese government doing to better manage this ever-changing situation? Well, I think it is firstly significant because, I think first we need to go to the very beginning of this. This is something that's unprecedented. We've not seen this, something of this scale happening in the world before. This, when you compare it to SARS, which is the last large-scale sort of outbreak in the world, at the time, people weren't as connected as they are today. So that really makes a lot of difference. And the Chinese government is doing all they can. So what we've heard since last week is that they're inviting WHO experts to come into the country to help to deal with it, because having this sort of international cooperation with experts from elsewhere, it does help, because even though the Chinese experts are quite good, very, very good, in fact, at what they do, different countries do focus on different parts of research, and bringing people together from all around the world really does help. And so we've just seen that they have agreed to let US experts come in as well. There's nothing, it's nothing new. It's something that is ongoing. But so one thing that has happened is that our China Bureau Chief Tan Dong-wei, she spoke a lot about the hospitals that have been specially built to deal with this virus. Now, today, we have now seen that the hospitals are actually functioning, patients are getting transferred in. So that is another thing that they are doing. And I think as the hospitals really do get up and running in the next few days, we could see a slight improvement in the situation.
And Liz, if you could comment as well in terms of what Hong Kong is doing, because Hong Kong has reported its first death today. Any comments on that?
Well, obviously in Hong Kong, it is slightly controversial, because we do know that a lot of the medical workers are on strike now, because they have asked that Hong Kong closes all of its borders with China, and the Hong Kong government really has dragged their feet quite a bit on that. So now, the fact that there has been a first death, maybe we could see a change in what happens, because even though many of the borders have been closed, but several of them, including the international airport, have still remained open, and so that is what medical staff are protesting about. They want the government to close the borders, because they feel that when this really spills over, mainland Chinese could come into Hong Kong to seek medical treatment, and that is going to overwhelm the system. Or even if there were just a community spread, which is something that both Hong Kong and Singapore are definitely afraid of. That would basically just strain the medical system to a point when no one could cope. And then I have to bring in Macau as well, because so Macau now has ordered its casinos to close, and that is very, very significant. So I think that there are developments that we have to see in the coming days.
And Liz, it has been 2 weeks now, about 2 weeks since the lockdown in China. Now, how's the spirit there? How are the people that you've been keeping in touch with? How are they coping with the situation?
Well, so as you can see, I wrote a story about it on Sunday's paper. It's right here. Please look at it on the Straits Times app or go look at our story online. So basically what they are trying to do, these people are divided into two camps. One is that you're either trying to keep upbeat and as positive as possible. So like Scarlett, she's just watching a lot of videos and trying to read more books, whereas there are others, which like some of these students that I've spoken to, they seem to be a lot more downcast. They feel as though they've just been left behind and forgotten about, and they're sort of like wallowing in this very dark place, which is quite difficult to be in because there is no end in sight. And what I also do know is that, in fact, there are about just over 100 Singaporeans that are still in Hubei province as well, and they have been keeping in touch with the embassy, and amongst them there are about 20-something children. So that group is, they are connected with each other and they're trying to support each other to keep their spirits up.
On that note, Liz, what about then the foreigners, the non-Chinese who are stuck in Wuhan, because there are no plans yet to evacuate them?
Well, so of the foreigners, there are countries who have evacuated them. Like, for instance, Singapore has done it, America has done it, France has done it, quite a lot of countries have done it, but significantly, Pakistan has not done it. And in fact, Pakistan Foreign Minister came out yesterday to say that, we are standing with China as our Chinese brethren, and so because they said that the medical system in Pakistan cannot handle an outbreak of this sort, and also they might spread the virus to Pakistan, so it's better to keep them there. Cambodia as well. Today, Hun Sen has actually said that they want to keep Cambodians in Wuhan. There's no plans to evacuate them. Significantly, so I've spoken to some Pakistani students. They have put up some videos on Facebook. They're trying to call on people to pressure the Pakistani government to try and get them out. But obviously, they do feel like they have been abandoned a little bit, and they feel like nobody cares about them. They're just in this very frustrated place, this sort of a very dark hole now. But that being said, some others, like this other student I spoke to, Emmanuel, he is from Ghana, and he is keeping really, really positive. So he's doing all sorts of different things. He's going online, and he's just trying to keep his spirits up. What exactly he is doing, I think you can read more about it in that's him, Emmanuel. And so you can read more about it in our story that should be coming out soon.
Certainly looking forward to that. Now, Liz, it's interesting, right? You mentioned regarding two camps. So there are some countries who are, they've evacuated, they've had evacuation plans, and then on the other hand as well, there are countries like Pakistan and Cambodia. They have said that they're standing in solidarity, like you mentioned, with China. So it's really weighing these two things out, right? On one hand, it's show of solidarity, and the other, it's public health emergency situation. And you spoke to some analysts as well. What comments have they got in terms of balancing these two, as it were, priorities?
Again, there are two sides to it. One analyst I spoke to, Prof. Xu, who is in Hong Kong University. Well, he's a historian, and he says that this is something that is of unprecedented historical. There has been nothing like that in history before. So China really is trying to find its way around. Of course, there were several missteps in the beginning, especially within the local government, where they have not handled it as well as they wanted to. But then as time went on, of course, they did get it together. The thing was that because China is just now in this really, really strong diplomatic position now. It is different from where it was during SARS. So obviously there are diplomatic concerns as well. And as you could see yesterday when the Chinese Foreign Ministry spokeswoman Hua Chunying actually lashed out at the US saying that all their comments were unhelpful, and in fact they were the first to pull their citizens out of Wuhan. Prof. Xu actually pointed out that you can look at this in two ways, because basically that is really, China does need as much help as it can. It needs help from all of its friends. As the foreign ministry keeps saying, that a friend in need is a friend indeed. And so people they do need as much international help as possible, because for now supplies are running low, and they do want international help. But at the same time, they do need to play to their domestic audience as well, to show that, hey, we are the strong country and we can't let people be saying all these horrible things about us. So we are trying our best, and therefore there is that rhetoric that is playing to the domestic audience.
Well, thank you so much, Liz, for coming into the show, to shed more light on the situation overseas. And of course, we are certainly looking forward to you returning to the office tomorrow. Now, for more on the coronavirus situation overseas, you can head to straitstimes.com.